Please rise for the 2011 Chief of Staff Team Excellence Award judges. Please be seated. Good afternoon and welcome to the 2011 Chief of Staff Team Excellence Award presentations. I'm Mark Johnson and I'll be your narrator for today's event. As a courtesy to the presenting team, we ask that no one leave the room during the team's address. All cellular phones, pagers, and cameras must be turned off. We will have a 15-minute team presentation, followed by 10 minutes of questions from our panel of judges. At this time, I would like to introduce our distinguished panel of judges. Major General Dwayne A. Jones, Director of Resource Integration, Office of the Deputy Chief of Staff for Logistics, Installations and Mission Support, Headquarters United States Air Force, Washington, D.C. Major General Edward L. Bolton, Jr., Director, Space and Cyber Operations, Directorate of Operations, Deputy Chief of Staff for Operations, Plans, and Requirements, Headquarters United States Air Force, Washington, D.C. Brigadier General William Buck Waldrop, Jr., Mobilization Assistant to the Directorate, Plans and Programs, Headquarters Air Combat Command, Joint Base Langley, Eustis, Virginia. Brigadier General Gina M. Grosso, Director, Manpower Organization and Resources, Deputy Chief of Staff for Manpower, Personnel, and Services, Headquarters United States Air Force, Washington, D.C. Brigadier General Select John L. Dolan, Deputy Director, Legislative Liaison, Headquarters United States Air Force, Washington, D.C. And now, I would like to introduce the Minot Doors Reporting Suite Initiative Team from Minot Air Force Base, North Dakota.
Bioenvironmental engineers, also known as bees, protect our airmen and mission partners from occupational and environmental health hazards that lead to illness and ultimately mission degradation. Bees are highly trained and equipped with advanced seaborne detection technologies. They are a focal point for OSHA and EPA compliance and oversee military operations involving toxic chemicals, noise, radiation sources, heat stress, and pathogenic substances. Whether in garrison or deployed, bees advise and assist commanders with the management of installation health and safety programs and ensure our workforce is well protected and mission ready.
Good afternoon. My name is Lieutenant Colonel Joseph Silvers, and I'm here today with Master Sergeant Loretta Fisher. The video you just saw is of our amazing bioenvironmental engineering flight at Minot Air Force Base, and that's what we do. We identify, evaluate, and control health hazards affecting our industrial workforce and Air Force communities. In fact, several weeks ago, Minot experienced a catastrophic flood that destroyed over 4,000 homes and displaced 1,000 of our airmen. During post-flood recovery operations, our team conducted public health briefings for roughly 1,500 emergency response workers. And when the base drinking water supply was found to be contaminated, our flight played a pivotal role sampling the water supply and restoring basic services to the community. But that's not why we're here today. Master Sergeant Fisher and I are here to show you how our team is shaping, streamlining, and improving the Air Force Occupational and Environmental Health Program. More importantly, we want to show you how our efforts are helping the DoD prevent the next Gulf War syndrome. Following the Gulf War, a significant percentage of our returning U.S. veterans were affected with a multi-symptom disease of unclear origin. As our healthcare providers and senior leaders struggled to determine the cause of the illness, they were impeded by a lack of environmental exposure data. So much so that in 1997, President Clinton called for a federal plan to improve the quality of DoD exposure monitoring, analysis, and documentation. In response to this presidential directive, the DoD developed the Defense Occupational and Environmental Health Readiness System, known as DOORS, to improve the way the services track and report occupational and environmental health, or OEH, data. DOORS is an Oracle-based online information system, and in accordance with DoD policy, all services must use this system to track OEH exposures to U.S. service members. But while the basic DOORS tracking system is functional, the DOORS reporting system is grossly inadequate. So inadequate that in 2005, the General Accountability Office released a report that found significant limitations in DoD's ability to address immediate and long-term health issues through existing reporting capabilities. And military services had to look to other alternative information systems to document OEH exposures for deployed forces. But the standing DoD policy is that we must use DOORS. So what are the problems with DOORS reporting capabilities? Here's a 125-page sample DOORS report for just one of our maintenance shops. This report is supposed to go into each worker's medical record. But if you were a doctor, do you think you'd have time to review this report during a patient exam and be able to use this report to analyze exposure results and ensure the correct medical exams? Would you consider this a good report to file in the individual's medical record? How about from an operational standpoint? If you were a squadron commander, would this report help you identify hazards within your unit? Would it help you practice good ORM? Would it help you understand that what you need to do as a commander to mitigate and control hazards within your higher risk work centers? We need DOORS reports that provide you this kind of information to protect the health of our airmen and mission partners. But DOORS simply does not have this capability. So in order for us to give you the information you need, our technicians have to spend numerous hours entering data into DOORS and then copying and pasting the relevant data into Microsoft Word or Excel.
To better understand how much time we were spending creating these reports, we conducted a time study in September 2009. A healthy bee flight should be spending roughly 50% of their time in the field conducting initial program reviews and collecting OEH data, and 50% on DOORS data entry and associated reporting. What we found was disturbing. In this pie chart, blue represents the amount of time we were spending in the work centers assessing health risks, and red represents the amount of time we were spending on DOORS data entry and reporting. So as you can see, we were not spending the amount of time out in the work centers collecting the critical data we needed to quantify personnel exposures. This is exactly the problem we had in the Gulf War, because we didn't have that exposure data that is essential for determining or ruling out causes of illness. Seeing that this was likely a much larger issue, we approached Air Combat Command and asked all 17 bases how they were using DOORS reports. Across the board, they were having the same issues we were and had come to the same conclusions we had. So we decided to do something about it. First, we obtained approval to access DOORS table structure. Then we sifted through over 3,000 data tables and found a way to extract the appropriate information necessary to build the reports we wanted. These sample reports were our first breakthrough to solving the DOORS reporting problem. Having both a mission and customer focus, these reports identify personal protective equipment requirements for workers, OEH hazard information for supervisors, and risk mitigation recommendations for commanders, and OSHA compliance tools for bioenvironmental engineers. The Rosetta Stone of these reports is the OEH exposure data form, which is used by healthcare providers to analyze personnel exposures and determine appropriate medical exams. We presented this report in July 2010 to ACC, and the Bs of Air Combat Command found this concise, 2-page report much more effective than the 125-page CAN report that Lieutenant Colonel Silver showed you earlier. Shortly thereafter, this report went through an intense peer review process that included over 100 physicians, public health officers, and Bs representing all MAGCOMs, as well as the Air Force Medical Services Agency. Here you can see that aircraft structural maintenance is a high-risk industrial work center with 60 personnel. These workers are exposed to hexavalent chromium, an OSHA-regulated chemical, while they are priming aircraft parts and conducting bee blast operations. These are the measured exposures and associated regulatory limits. Personnel are potentially overexposed to a confirmed human carcinogen, but are being protected with respirators and a ventilation system. To simplify ease of accessing these reports, we developed a user interface that enables any installation to access their OEH information. We term this new capability Doors Reporting Suite, or DRS. In August 2010, the data set was expanded to include all 92 Air Force installations, 10 Air Force Reserve bases, and 82 Air National Guard bases. Minot's DRS has been presented at several symposiums and poster sessions, to include the 2010 AFMS Senior Leadership Symposium in Leesburg, the 2011 ESO Symposium, and the 2011 American Industrial Hygiene Conference, where the capabilities of the system were showcased before civilian industry professionals and subject matter experts across the DoD. This would be a good time for me to point out that all the data from our reports comes from the DoD DOOR system. DRS is only a reporting tool, and since data in is data out, we developed a field guide loaded with screenshots, illustrations, and guidance to help Bs across the Air Force with the DOORS data entry efforts. These business practices were tested by our bioenvironmental engineering team at Minot and vetted through the ACC DOORS working group prior to distribution around the Air Force. As a result of our reporting system and associated business practices, our occupational and environmental health program was identified as an Air Force Inspection Agency benchmark in 2010 and 2011. In only 12 months, Minot's reporting suite has been adopted by 32 installations across the Air Force.
More recently, DRS was further developed to include all Air Force, Army, and Navy installations, encompassing 95,000 industrial work centers. In this third-generation Minot DRS product, an additional report was created to assist installation and organizational commanders with operational risk management practices, as shown here. We can generate reports like this for any installation in the Department of Defense. There are no comparable reports in DOORS or any other DoD system. In terms of sustainment, Air Combat Command, Air Force Global Strike Command, and Air Force Materiel Command are fully on board and have already employed DRS. Additionally, AFMISA has adopted 4 of Minot's reports and submitted them to the Department of Defense for inclusion in future updates to the DOORS system. Here you can see how easy it is for an installation commander to get a snapshot of his or her industrial workforce. Organizations, indicated here, have workers that may potentially be exposed above OSHA limits. Additional information on the types of hazards and degree of exposure is listed here. You can also see what mitigating controls are in place to protect workers. These exposures are listed on a worst-first basis. For those cases where risk assessment codes, or RACs, have been assigned to a hazardous process, the installation commander can see how long the RAC has been open and what fixes are in place to resolve the deficiency.